everyone. Good afternoon. Thank you for joining us for this second section of our sexual assault conference. This is a very sensitive topic, so if you feel the need to step away, please do so. And if you feel that you need resources, please message me in the chat and I will do what I can to get them to you. We're grateful for the work that our guest Michelle Shores does with the sexual assault response team, and we're appreciative that she's able to spend some time with us today. This session is being recorded. You will have the opportunity to ask questions via the chat box or the question box. I will be monitoring throughout. If you prefer, at the end of the broadcast, we will turn the recording off. And if you're not comfortable putting your questions in the recording, we can definitely take care of you at the end. So this is our guest, Michelle Shores. Michelle is a forensic nurse examiner and the program director for Palomar Health Forensic Services in San Diego County. The Forensic Health Services Program is a nationally accredited child advocacy center that provides acute care services for victims of sexual assault and domestic violence. Michelle is one of 16 board-certified pediatric sexual assault nurses and one of 47 board-certified adolescent adult sexual assault nurse examiners for the state of California. Michelle has recently implemented a pilot program through a county grant at Forensic Health Services to perform 688 forensic medical evidentiary exams for victims of domestic violence, strangulation, general assault, and elder abuse. Michelle graduated with her bachelor's degree in nursing in 2005 and began working as an emergency department trauma nurse in 2006. In 2012, Michelle earned her master's degree in nursing, master's degree in business. Michelle was a clinical nursing instructor, is a certified emergency nurse, International Association of Forensic Nurse Board certified, SANE-A for adolescent adult, and SANE-P for pediatrics, and a certified trauma nurse instructor, TNCC. She has been a longstanding member of the International Association for Forensic Nursing and is vice president for the Southern California chapter, a member of the Academy of Forensic Nursing, and has worked as a forensic nurse for 6 years. Michelle cares for pediatric, adolescent, and adult victims of sexual assault and domestic violence. She is the co-chair for the San Diego Sexual Assault Response Team Steering Committee and the chair for the San Diego Domestic Violence Council Medical Committee, a member of the San Diego County High Risk Domestic Violence Team, a member of the Child Advocacy Centers of California, CACC, State Advisory Committee, and the president of the Sexual Assault Forensic Examiners Association. In 2018, Michelle introduced the idea for AB 3189 along with the CalSafe team. AB 3189 is a bill that provides minor victims of intimate partner violence the right to consent to medical care and forensic exams in the state of California. Michelle has worked with the California Clinical Forensic Medical Training Center team to provide training to examiners. Michelle is a contributor for the workbook manual non-fatal strangulation assessment for healthcare and first responders and adolescent and adult sexual assault assessment, 2nd edition. She is also the 2017 winner of the San Diego County SART with the Heart Award and the 2018 Riverside County SART Nurse of the Year Award, the 2018 San Diego Domestic Violence Council Lifetime Achievement Award, November 2018 CARE Award that recognized her as leader in the community and excellence as a forensic nurse examiner. Also the 2014 nationally recognized DAISY Award by the Family of Patrick Barnes Foundation, which recognized Michelle's extraordinary nursing care is intuitive in assessing what type of needs a patient has beyond their physical presentation. Strong advocate for women, children, and victims of assault. Patients, family, and staff trust Michelle because of her commitment to providing outstanding patient care. Michelle is married and is the mother of 2 boys. She enjoys collaborating with the multidisciplinary team, and the exam can be the victim's voluntary first step towards healing and justice. The forensic exam gives the victim back their power in hopes they leave on the road to survival. So thank you, Michelle, and welcome. We appreciate your time here today.
Thank you. I appreciate coming today and being on the other end of you reading that. It's definitely been a very exciting journey, and I was born to be a nurse, and that is what I love doing. So thank you for having me here today.
Of course, thank you very much.
And then I am going to share my screen. If I believe I've if you haven't passed that back to me, would you mind doing that, Joy? If I have that. So thank you for having me today, in this new virtual world. And I think that this is a good way, leveraging technology to allow us the opportunity to connect although I love being in a room with with people and talking, because believe it or not, I like to walk and talk, and it's the ER nurse in me, however, I will say that virtual has allowed us to expand in our reach. So I will just echo what Joy mentioned. Some of the topics that we're going to talk about today, they are very sensitive. And are you able to see my screen now, Joy? Is that coming up?
I see it
Uh,
perfectly.
okay,
Thank you.
okay, great. So again, I have really taken this career and the opportunity in this career as being a nurse to impact my community and in a different way. In by looking at my previous history as a trauma nurse, I really kind of take that into heart, as trauma care is also beyond the physical presentation. So I am the director for the Forensic Health Services program here in San Diego. I got my start as a uh, forensic nurse in Washington State. So I worked in the Kitsap Peninsula out in Washington. I came back to California in 2015. So when we talk about forensic health and forensic healthcare, going back to this real fast, is really the terminology is that this is the intersection between health and law. And I find our role in forensic health very valuable in talking to the multidisciplinary team and really surrounding patients. The other thing I just want to just share is I please don't be afraid to ask questions in the chat. And then also as far as language, in just understanding like the concept is somebody comes in as a victim of a crime because that as a victim of a crime they have rights, and there are things, that is why they typically come to us. In my role, they are my patient. I'm a healthcare provider. And then, utilizing the survivor language is very much in line with advocacy and health advocacy. So sometimes those words get used interchangeably, and it sometimes just depends on where someone might be in the process. So the other thing is pronouns. I no disrespect, this happens to both male and female and other, but if I utilize he or she pronouns, it's not to mean one or the other. It just sometimes comes out in conversation. So I'm just want to make sure I put that out there. So looking at our center and in what Forensic Health Services is, we are a comprehensive center that cares for victims of crime, patients, people who've experienced sexual violence, physical violence, or other. And so understanding trauma, going back to that, is trauma can be emotional, physical, spiritual, and we know trauma causes damage. So when we think of trauma, we really having that perspective of, if I walk by a table and I hit my knee on the table, it one, it might not have been my fault. I just hit my knee on my table. Two, it's gonna hurt. It probably will cause some injury to my knee. And so forth. So I think when we think of trauma, it's an external insult. It's an abnormal event that happens to people, and we, based on our response, I think as a community is where we're really going to be talking about that today, and utilizing the abbreviations. So I speak a lot in abbreviations sometimes, so please don't hesitate to ask a question to clarify. And because this word is so long, the multidisciplinary team approach, I'll probably be using MDT quite often today. So utilizing that multidisciplinary team approach to care is really best practice. So think of this as forensic health services is the overarching umbrella. Underneath our program, we have two pathways. One is our Child Advocacy Center, and so that, or we refer to as CAP. So Child Advocacy Center, or the Child Abuse Program, was established in 1984, and it really came out of the movement in the 80s that, to minimize how many times children were talked to really have that best practice approach. And I'm going to show you a short video on a CAC here in a few minutes. So the Child Advocacy Center is a nationally accredited center by the National Children's Alliance, and it's a one-stop shop or location where children under 18 can come in for forensic interviews. They can come in for the medical acute or non-acute evidence exam, which is a focused medical assessment. We'll be talking about that today. We also have no cost trauma therapy, advocacy services. So there's 10 standards you have to meet to be an accredited child advocacy center. Additionally, our program, which was started in 1991 out of the response of a woman who was assaulted and had gone to multiple hospitals and nobody knew how to help her. There was a group of nurses that came together and started what we call the sexual assault response team. So within that capacity, we say SART a lot in the state of California. This is a SART exam or a SART. Fundamentally, what it means is it's a group of multidisciplinary team members, such as law enforcement, the forensic medical nurse, our provider, advocacy, all the different partners working together. And so that program has been established since '91, and our program is a centralized team. We care for the entire county of San Diego. Keep 3 nurses on call 24/7 and manage the volume. And our commitment is, once we're dispatched, is to arrive at one of the private locations within an hour of being called. All outpatient services. Additionally, expanding access to the full comprehensive services in 2017 came when we added the medical evidentiary piece, or the medical portion, to those that have experienced strangulation, intimate partner violence, human trafficking, gang violence, and other. And then we also do the well intake assessment. So these are some of the examples of the multidisciplinary team: law enforcement, child welfare, victim advocacy, mental health, and really, and other community partners. It can be a comprehensive list, and the goal is to have fewer cases falling through the cracks, to have more, the patient doesn't have to tell their story multiple times. The team can really collaborate and really pull together so that you don't have 5 people asking the same person the same story over and over again. And it's really meant to protect that patient and us wrap around them. So in our county, we have multiple locations. We have our downtown Escondido, our Palomar Health Escondido location, which is our child advocacy center. We also have a location in Poway, which is mid-county. We have a location for sexual assault exams and DV exams at the San Diego Family Justice Center downtown. We also have a off-site response if a patient cannot leave one of the hospitals safely, or our nurses would go to them. We cover we're partners with Rady Chadwick, and we cover them nights, weekends, and holidays. They are our partner CAC to the south, and then UCSD Student Health. So really we have a very diverse and mobile team. And so kind of looking at what services are available. So for all of the medical services, those are 24/7. We always have we have 3 nurses on call 24/7 to monitor, to be able to respond efficiently to our patients. And then our child abuse program is more business hours, Monday through Friday. And we also offer in one of our locations a soft room, which is a trauma-informed a location where victims or patients of human trafficking, the task force along with the advocacy partner can come to our center and in safety plans, so they're not bringing a victim of CSEC or human trafficking to the jail to do that. So really just trying to create that trauma-informed soft room location. And if it's okay, I'd like to just show you a quick little video that we made for our Child Advocacy Center accreditation, and it walks you through what our center looks like. And so I'm gonna, oh, I can see your screen now. All right.
It's the first video, Michelle?
Yes, ma'am.
It's Cohen.
The Palomar Health Child Abuse Program is a nationally accredited child advocacy center by the National Children's Alliance. Our Child Advocacy Center is located at 121 North Fig Street in Escondido, California. And the designated service area for our Child Advocacy Center is North County, San Diego. The Child Advocacy Center is currently located on the Palomar Health downtown campus, easily accessible from Interstate 15 and Highway 78. There is adequate parking, including wheelchair accessibility, located in the back of the buildings. When patients arrive to the CAC, they enter through a secure glass atrium that connects the 2 buildings. Patients then enter the center lobby, a child-friendly waiting area where there is comfortable seating, age-appropriate toys, and culturally diverse reading material. There is also a TV and age-appropriate videos. When families arrive to the center lobby, they are greeted by CAC staff, offered a beverage, and the clinical team will briefly describe general processes of their anticipated services. The pre and post interview gatherings will take place in the CAC conference room, where multidisciplinary team members and caregivers can meet and discuss the case in a private, confidential space. Multidisciplinary team members will then gather in the CAC observation room, where there is comfortable seating and a counter workspace. Our multidisciplinary team will observe the interview through a one-way mirror or on the computer monitor. The forensic interview is recorded using a high-definition video camera placed on a tripod and recorded onto our secure IVS vault system. Audio is received via speaker. Our Palomar Health CAC forensic interview room is small yet comfortable, a safe and neutral space where children can be interviewed. The furniture in the room can be easily arranged to accommodate children and adults of all ages. The forensic interview room is soundproofed and has a covert microphone system and wiring that connects to the adjacent observation room and is separated by the one-way mirror. We have an interpreter line or a screen that can provide interpreter services for both ASL and all other languages if our bilingual staff are unable to provide interpreter services. Our Child Advocacy Center has 2 medical exam rooms. One is prepared for the adolescent adult population and the other for pediatric patients. The exam rooms are equipped with supplies and state-of-the-art equipment such as SDFI secure digital forensic imaging camera. Acute and non-acute medical exams are conducted here. In our pediatric medical room, we have placed pediatric-friendly focal points, such as this mosaic on the wall, to make the room more comfortable for children during their medical forensic exam. Our Child Advocacy Center has a private single shower and changing room for patients who have undergone a medical forensic exam. Each patient is given a change of clothing and a toiletry bag that has been donated from a partner agency. The Child Advocacy Center has a designated area for evidence storage, including locked cabinets and a locked refrigerator that is temperature monitored. Each kit is picked up by the crime lab once a week to be compliant with local and state laws. Our Palomar Health Trauma Therapy Room is spacious and filled with developmentally and culturally diverse toys. The center has a designated area where we store emergency supplies or comfort items that have been donated by one of our community partners. The patient records room securely stores all physical charts. A secure forensic encrypted drive holds electronic patient charts as well. Our Palomar Health Child Advocacy Center is the only location in North County, San Diego that offers a soft room or a location to be utilized by Human Trafficking Task Force and advocates for victims of human trafficking or CSEC. The soft room allows a space for calm, trauma-sensitive interviews by investigators in a confidential manner. There are a total of 3 restrooms available for staff, patients, and families. We also have areas that are private for our staff to perform the crucial work they do as a team. Our Child Advocacy Center is a hospital-based program, and we follow all of the district rules and processes for safety. Our center in each building has designated exits, fire extinguishers, security radios, as well as defibrillators in case of an emergency. Our center has taken every precaution during the coronavirus pandemic to ensure the safety and security of our clients and partners entering the center. Posted on the door of our center, we have signs in both English and Spanish that communicate coronavirus safety precautions. Additionally, we provide masks and hand sanitizer to all that are going to be seen at our center. As a hospital-based child advocacy center, we follow the overall mission of our organization, which is to heal, comfort, and promote health in the communities we serve. More specifically, our Child Advocacy Center mission is to provide a foundation of healing and comfort while offering a trauma-informed, professional, compassionate, and coordinated approach to the care and evaluation of physically and/or sexually abused children, adults, and elders. Our Palomar Health Child Advocacy Center was established in 1984. Our vision is to be nationally recognized as the provider of choice for forensic evaluation and treatment, comprehensive assessment, trauma-informed victim services, abuse and assault prevention, and community awareness and education. We remember and honor those who started the program and who have contributed to its growth and expansion. Our Child Advocacy Center continues to grow and expand to live the mission and the vision that we have set forth. Recently, we have added additional adjunct music and art therapy to our trauma therapy program. It is our hope that all who enter this space feel welcomed. We are committed to providing trauma-informed services for all that enter into the space so they feel welcomed, heard, and they leave with a sense of hope.
Thank you for playing that, Joy. I thought it would be helpful, although this was made specifically for our reaccreditation, you get to see the physical space that, I speak a little bit of children, but sexual abuse for children, adolescent, and adults. So this is one of our centers. So hopefully that puts into context kind of what what we're looking at, because we're trying to avoid patients having to go to emergency rooms if they don't have to. And we know that there's a financial cost to abuse, and we know that on if we do not respond in a timely manner, increased ACEs, all of these things for our entire population can impact. And so how do we know that this emergent response works? It's really self-report and the decrease in PTSD symptoms for patients. So I'm going to go into a little bit more detail into the medical exam. So again, understand that in the state of California, we are a medical mandated reporting state. That means that there will never be a sexual abuse case with or without injury that we are not able to report to law enforcement. There are options that the patient can choose to participate in investigation or not. But by law, our program will never issue a bill to a patient. It's illegal actually to bill a patient directly or indirectly for services in the state of California. We also have we go through a really rigorous consent process that I'll go over with you, and we provide all this at no cost to the patient. So again, if you like reading the penal codes, the 11160 in the state of California is the medical mandated reporting. So in California, when there has been a report of sexual assault, law enforcement by law is the authorizing party and the payer of source. So for centralized teams, what does that mean? So that means that if there was a person assaulted, they walked into a hospital, in any area, the hospital could do a medical screening. We have really great protocols in San Diego, because ideally they might just need to be connected to one of us, because this will decrease the amount of bills, exposure, and also making sure that the centralized trained professionals are caring for the victim. So ideally, not all medical care is equivalent. So this is something where really looking at the specialty of the medical exam. However, in the state of California, we have to have law enforcement authorize these exams. It will always come with a case number. So it's just it's kind of a different from some states. So the medical evidentiary exam, SART exam, forensic exam, these are interchangeable terms. It's a focused medical assessment. We go through, the process takes about 2 to 3 hours, typically about 2 hours for the history, and I'll walk you guys through this. So the nurse will, the pathway into the center is normally, it usually is law enforcement that has been engaged or one of our partner advocates. Sometimes the patients call us directly, but more than likely they have reached out to law enforcement, and they call the on-call nurse. The on-call nurse then arranges the most appropriate location. We contact our partner sexual assault advocates, and we all meet at one of our designated locations. The nurse will do a quick history with the law enforcement officer. Not much. The advocate, the patient will have some time to speak to the advocate privately prior to the exam, and then we all meet in one of those conference rooms. And the nurse really goes over, really tries to help that patient understand what this is. And we explain, that as a victim of a crime, they have rights. They have the right to say yes or no to any part of this exam. They have the right to have this exam at no cost to them. And they, again, have that power over their body to make these decisions. We help them understand what the exam is, that we will be asking them some basic medical questions that we'll ask them to tell us in their own words just what happened, and we're documenting all of this very carefully. And then we ask clarifying questions, and we use a standardized form in the state, and we really are assessing like our lens is not, we don't work for the prosecution, we don't work for law enforcement, we are medical professionals. So we are hearing all this with that medical lens as well as the forensic lens. So we're also thinking, okay, where might we want to take the swab and yield evidence? We explain that to the patient. We take pictures with their clothes on, with their clothes off, to include the genital region. And we explain that to the patient, and they get to make these choices ultimately. And we have crisis intervention. We provide at no cost NPEP, which is HIV prophylaxis if appropriate, emergency contraceptive for our adults. We don't test adults for STIs because it's not relevant, and if someone's assaulted, they probably will not be positive within the first few days. So we treat prophylactically and get them connected to services. For our kids, we do test our kids because for a STI or a sexually transmitted infection in a child can be diagnostic of abuse. So really we just experts in understanding those populations. And it's a dual purpose again. It's the medical first, always medical first, and then that evidentiary collection using the really highly trained, skilled forensic nurses to collect the evidence. And so there's, in the state, remember I told you that there's we are medical mandated reporting state. So the nurse will always have to give basic information to law enforcement. The other thing that happens in California is the sexual assault evidence kit will always be tested. It's not a choice. So the patient needs to understand, if they're choosing the NPR option, that the kit, no matter what, will also always be tested. So we talked a little bit about traditional pathways. So where law enforcement is, the patient has chosen to participate in the engagement with law enforcement. So they're working with law enforcement. That is their choice. They are moving down the investigative path. They can stop at any time in the process. But there's sometimes where patients just aren't sure, they're not ready. So even though we have to report it, they can still choose to not participate with law enforcement. So law enforcement, it doesn't need, law enforcement will honor their wishes, and we have really strong relationships with our law enforcement partners. Should a patient choose the NPR, the non-participating report, they can still have the full comprehensive services we offer, the evidence collection. They're just choosing to not push forward with an investigation. And I think that's a misconception when people approach sexual assault, is they come at this of, if they've been sexually assaulted, well, do you want to prosecute? And that's not really good terminology. It's connecting someone to the next step, right? So once there's been a disclosure or a concern, is offering them that medical piece and then taking it step by step. And sometimes people just need more time to understand what they want, what they need. In California, our time frame is 120 hours or 5 days for adults. Sooner the better. It gives us better evidence, and also the tissue in the mucosal tissue, like the mouth or the genitals, can heal very fast if there's injury. It's very vascular, a lot of blood vessels that can heal fast. So we typically like, and for yielding of DNA, and if there's pain or bleeding, we could see them out further. So we really just try to push the education of, in the community, and this is where I think community partners can having these education is, know who to, you might not always remember what to do, but it's okay. Thank somebody, say thank you for telling me, I know who to call. Or I think often we want to respond and rescue, but it's about like knowing who to call, because I also need to know who to call. Like we have great community partners that help us navigate through systems as well. And again, these goals is really just getting that patient that health screening as well as the evidence collection. And in the state of California, and this might be different, so our family codes 69, 6927, 6928, and 30, I believe, minors 12 and older in the state of California can consent for the medical evidentiary exam and treatment. They can come in and they do not need a parent. They actually have consent rights to say yes or no. So that also means someone cannot force them to have an exam if they choose not to. This is very much a consent based. This is not a emergency life-saving exam. This is again, the patient needs to have a really true understanding of what this is and be able to consent. So in the state of California, 12 and older make that decision for themselves. And then just looking at the forms. So we use, in California, we have standardized forms. They're developed by Cal OES for adult, pediatric, domestic violence, as well as suspect exams. So here's an example of what those forms look like. We go through those questions, and the physical exam, once we take the history, we take the patient in the room, we do head to toe, we'll look at them with alternate light source, we'll collect swabs, so from different part of their bodies, mouth, face, neck, and so on. We take blood and urine, and we document everything. And then this goes in our standardized sexual assault kit. So in the state of California, we have a standardized kit that every have the same contents in it for every patient to have the standard of care. Again, this is, we just collect, we do collect evidence as part of our medical evidentiary exam. If there's potential saliva, if someone's been bit, spit on, fingernail scrapings, you name it. And the truth is we don't know what it is, and we're not making a diagnosis of that. It's just, if we notice moist secretions, it could be saliva, it could be blood. We know if we're taking blood, but hair, DNA, all of that goes to the crime lab, and it's up to the analyst to then make those determinations. We also have to be very clear in our language for injury, because if somebody might not have a memory, the forensic nurses have the training to look at an injury and see, is that potentially a blunt force, or like a punch or hitting the ground, or is it a sharp force like a knife? So injuries have different patterns, so it's very important for us to be intentional in our language and how we speak to injuries. We take photographs, again, head to toe. And we also we perform a danger assessment. We're looking at risk, we're looking at safety planning. And what can we tell and can we not tell from a medical evidentiary exam? We can tell if there's recent trauma. We can tell if what they're saying or not saying is matching what we're seeing. So for example, if someone says that they just came from the beach and was assaulted, and they come in and we find sand all of them, that's consistent with the history. So just looking at it from an objective lens, again, we're not making determination of innocence or guilt. Our role is to really be that objective party, listening to the history, those medical details, and then looking at somebody and seeing, is this, do these seem to match, right? And if not, like we look at that too. We cannot diagnose rape. So sometimes patients, and it's actually very normal to be normal and not have injury. I think there's a common misperception that people come in and they're going to have horrific injury if there was an unconsensual contact, and that's not true. Our female body was designed to have babies, designed for stool. The human body there's not always injury does not mean consent. So a lot of times there's that misconception that we could tell somebody if they were assaulted or not, and we can't. It really is part of a process with investigation, looking at the kit and pulling that together. And ultimately, it will be up to the judge and jury to make the determination of innocence and guilt. So I I am there to handle that medical piece. And then if this goes to trial, I am speaking to what I saw and what I heard, and it's in the court will then make that decision of as to rape or consent. It's not, those are not diagnoses in the medical world. So again, we can say if there's trauma or not. We can't say whether there's consent or not. The other thing that's interesting is, you know, it's actually physically impossible. You cannot age a bruise. So if anyone ever hears somebody say, "Oh, that's a fresh bruise," it's actually, we will never testify that a date of a bruise. The only color that's consistent is yellow is about 18, at least 18 hours old. So other than that, you know, everyone bruises differently. And believe it or not, the majority of our cases for sexual assault are non-stranger or acquaintance. Somebody's had contact prior. A lot of our cases, the stranger is less common in my experience. And again, alcohol is a really big drug for sexual assault, and we saw our sexual assault cases go down in COVID. So looking at a couple year walkthrough, and we believe it could be because of the stay-at-home orders and the less opportunities for acquaintance encounters at like parties or just in general with the stay-home orders. However, our domestic violence and our child abuse cases did go up. So, you know, it's just interesting to think about. A lot of people, I think, worry. You should always be careful, but it's more than likely somebody that the person knew. So, you know, the pediatric exam is for the nursing perspective. If they're under 12, because they cannot consent, we're not going to interview them. It's just a checkup, and it's all external, and it's really fast. And I personally love taking care of kiddos because they are they're usually so resilient, and I don't know, it's one of my favorite parts about it. I know it sounds very hard, but I love going in and caring for patients. Nothing makes me happier. And if you want later on, I'm just going to touch on this gently because I know we're running out of time, but intimate partner violence, DV, and sexual assault, there's a lot of, I would say, crossover or poly-victimization. And, you know, should you have me back, I can come back in October, potentially during your DV Awareness Month, and speak to our domestic violence programs. And I'll just go through that. And the other thing is strangulation is very, very dangerous. So, you know, just being willing to talk about these. We've changed laws, we've had health alerts, you know, we've published some of the best practices. We have our sexual assault protocol during COVID for San Diego County was published in the Journal of Emergency Medicine. It is, you know, we're setting these standards, and so looking at volume, like how many patients are we seeing? So for sexual assault, let me go to here. This is just a quick visual. So we see about 687 annually for our sexual assault, which means 14 and up for you. So SART is considered 14 and up in the county. Last year we had a decrease, like I said. Our DV cases did go up, our PEDS did go up in this last year. And looking at population that have come forward about, you know, we keep track of demographics, and this is all self-reporting for patients, and looking at the age ranges for our sexual assault, domestic violence, and child abuse. The other thing that we've been able to do is identify if there's children in the home during a violent event and bring them in for interviews and get them into comprehensive services. And believe it or not, since we've had our strangulation protocol, this is a huge thing, and someone who's had hands on their neck, whether it's with sexual assault or DV, they're 750 times more likely to be killed at a further event. It's a very serious, very, very serious thing. So we do ask specifically those questions. And of our sexual assault cases, about 13% report having strangled, and of our DV cases, up to 95% do. And since we've added the nurse for DV, I'll just give you some perspective. We have, just by having a forensic nurse involved, has raised the accountability for the prosecution fourfold, so from 33 to 64%. And then additionally, I'll touch on this really fast, is beyond the forensic medical, our hospitals and our community partners, our Planned Parenthood, our Peace Between Partners program, Strong-Hearted Natives Women's Coalition, they're part of the SART. We are very much all trying to work together. And so this CARES initiative was a way for other healthcare to know how to activate resources. So you can look at this on the web. I can send the link to Joy. There's a lot of great information. We continuously talk about this issue. We've made packets, we've made posters, we have community, our community partner events. This was pre-COVID. So, we have, again, therapy, connection to services. We have partners. I miss the day where we can all get together and I can honor our partners, because it really takes a community to do this work. And we all have our focus. And, April is both Child Abuse Prevention and Sexual Assault Awareness Month. And just to share with you fast, every year our organization takes this hot head on, and we don't shy away from it, and we place a pinwheel on the lawn of for every patient or survivor that was seen in our program. And the way I look at this with the pinwheel is the center is the patient and all of the fans are the partners, and we all have to be working together in unison for that pinwheel to flow. And this, if we're not, then it doesn't. So this is just a beautiful representation, and this is this year's. They're currently up at our Escondido campus and our Poway campus. And of course, we're going to strive to get this right for our partners. And Joy, I'd like to finish with one video, if we don't mind, and then we can open for questions. It's the third video, not the one that is the
last one you sent.
Yes, please, if you don't mind. So the reason I share this with you is every year for the pinwheel ceremony, we typically have a ceremony, and we bring survivors, we honor survivors, we bring them together. And unfortunately, we were not able to do that during COVID. So we looked at a way to, there was an animation done by a young boy whose mom is a forensic nurse, and she goes out to respond. And we utilize this to share with our partners as for a pinwheel ceremony. And just for a caveat is we do not own the rights to the music. So for the presentation. So with that, I'll leave you with this video, and then we can open for questions, if that's okay.
Okay, great. Thanks, Michelle.
You are not hidden. There's never been a moment you were forgotten. You are not hopeless. Though you have been broken, your innocence stolen. I hear you whisper underneath your breath. I hear your rest, so wet, your rest, so wet. I will send out an army to find you in the middle of the darkest night. It's true, I will rescue you. There is no distance cannot be covered over and over. You're not defenseless. I'll be your shelter, I'll be your armor. I hear you whisper underneath your breath. I hear your soul, your soul. Well, send out Lord, find you in the middle of the dark. No truth rescue you. Will never stop to reach you in the middle of the truth. I hear the whisper underneath your breath. I hear you whisper you have nothing left. I will send out an army to find you in the middle of the darkest night. It's true, I'll rescue you. I will never stop to reach you in the middle of the hall. It's true, you. Oh, I will rescue you.
Thank you for sharing that, Joy. And I just wanted to share with you all a little bit of the heart that goes behind this, and know that the team that is there cares, and they really put their life into this. And I hope I was able to bring some awareness to the subject and talk a little bit about what we do, and open it for questions, or however whatever you need, Joy. Anything
Okay,
for you, Joy.
well, thank you. Right now, I don't see any questions in the chat box. If anybody has a question, if you want to raise your hand, I can unmute you. There we go. Oh, I undid the wrong thing. Whoops. Anybody? I think we might have you did such a great job that maybe
Well,
you
and if questions come in later, you know how to get, we could send me an email. I think Linda knows how to get in touch with me as well. Anyone who I'm accessible, and I want you to know yeah, if something just comes up later or you're wondering about something, Joy, you can connect them with me, or you can ask me, however, whatever's safest or feel, for you all.
Okay, I'm going to check one more time for a raised hand, and then I'll turn it off and see if we have somebody that has a question to go off the record.
Okay, sounds good.
And I don't see that, so I'm going to stop the recording now. Oh, I have to read. I don't want to share my screen. I want to stop the recording.